This is Serve Your Community through Public Health AmeriCorps. Thank you for joining us. We will have a Q&A that you can ask questions at any time in writing during the webinar. So just use the Q&A button on the bottom of your screen to type your questions, and we'll get to them at the end of the presentation. I'm Tracy Seward. I'm the Senior Director of Educational Pathways and Undergraduate Education at the Association of Schools and Programs of Public Health. I'm excited to be joined today with a great group of panelists. We have AJ Perlman, who is the Director of Public Health AmeriCorps, Sade Ali, who is the Program Manager for Community Health, Pathways, Learning and Development for Baltimore Community Health Corps, Ciel Perry-Almartin, who is the Public Health AmeriCorps member of the MONSI Public Health Planning or Program Planning Special Assistant Coordinated Neighborhood Stabilization Response Fellow, also with Baltimore County Health Corps. Karen Perez, who's the Public Health AmeriCorps member from Appalachian State University, and Jennifer Schroeder Tyson, who is faculty for the Public Health Program and the PI and Program Director for Public Health AmeriCorps at Appalachian State University. With that, I'm going to turn this over to AJ Perlman, who is going to tell us all about Public Health AmeriCorps.
Hi, everyone. Give me just a second while I share my screen. And perfect. Tracy, can you see the Public Health AmeriCorps page?
I can.
Perfect. All right. And I see our participant numbers are going up as well. So thanks, Tracy, for having us. Thanks for pulling this webinar together. And happy National Public Health Week, everyone. This is a really exciting week, and I'm thrilled to be kicking it off by talking with all of you. And I'm also really excited to be hearing from some of our Public Health AmeriCorps partners and members today. They are definitely the star of the show. But let me go ahead and get started. If you haven't yet heard of AmeriCorps, we are the federal agency for volunteerism and national service. And so what we do is we provide people power and funding to some of our local and national partners to really tackle some of our nation's most pressing challenges. Through our partner organizations, we support both direct service to people in need, and we also support capacity building within nonprofit organizations, local governments, and others. So it's really exciting. Adults of all ages and experiences can participate in AmeriCorps, and AmeriCorps members really are doing opportunities of service that address our nation's really high priority issues. So just taking that as a baseline, you all probably know that we have a pretty significant workforce shortage when it comes to public health professionals. And that shortage started before COVID, but it really has been significantly exacerbated by the pandemic. And just to kind of give you a sense of how large that challenge is, a recent study found that local and state public health departments would need 80,000 more professionals to be able to adequately provide for public health services. So it's a pretty significant challenge that we are all working together to address. And that's where Public Health AmeriCorps comes in. AmeriCorps and the CDC have partnered together to create Public Health AmeriCorps, which is a program that's working to recruit and build a new workforce that's ready to respond to the nation's most urgent public health needs. As you can see on the screen, the partnership includes a $400 million investment from the American Rescue Plan Act, through which we are recruiting thousands of AmeriCorps members, some of which you will hear from today. The goals of the program are twofold. First, we're aiming to meet the needs of local communities by providing needed capacity and support in local public health settings. And we're advancing more equitable health outcomes for communities who are currently or historically underserved. And at the same time, we are looking to provide pathways to public health related careers and to really build the next generation of public health leaders who live in, come from, and represent the communities where they serve. So just to give you a sense, we currently have 82 programs that are being funded through Public Health AmeriCorps, and they have received funding to support members who are serving across the country in almost every state, plus in Guam and Puerto Rico. Now, we have a range of organizations that are participating, from local community-based organizations and national nonprofits to local health departments, state and local governments, universities, and tribes. And just to kind of put a little bit of context here, last week, in terms of what members are doing, last week I met with members of the Minnesota Public Health Corps. One of them, his name is Donovan, told me that he is working in a local health department in Minnesota, and he's helping them implement an HIV prevention social media campaign that's specifically targeting HIV prevention in Indigenous communities and among homeless individuals who live in Duluth, Minnesota. So that's just one example of what our Public Health AmeriCorps members are doing. We also have members who are serving as peer recovery support specialists in Illinois and Virginia, really directly supporting individuals who have experienced substance use disorders or other types of behavioral health challenges. We also have members who are supporting vulnerable seniors or others, assisting them in navigating the healthcare system, so to get access to mental health resources or to get connected to care, healthcare specifically, or to be linked to other community resources. So as the top says, we are engaging 3,000 AmeriCorps members in just this first year, and members have been serving since last summer, but members are, new Public Health AmeriCorps members are starting every day, including today. So this work is really ongoing. Our grantees have diverse focus areas and are addressing various public health issues ranging from COVID-19 recovery to behavioral health and health equity. And this was really intentional because we wanted the funding to be flexible enough to allow communities to tell us what their most urgent priorities are. You're probably wondering what you might get out of Public Health AmeriCorps. And this is really a chance to begin your public health career journey. The only requirement for serving is that you be at least 17 years old. Public Health AmeriCorps members come from diverse backgrounds, and they don't need to have any previous public health experience or any higher education degree. We also offer both full and part-time terms of service, and many of our members serve part-time while they're in school. So while you're a member, you get to have hands-on experience in a public health setting, whether that's through community engagement at public health fairs, helping individuals get linked up to healthcare, as I mentioned, or really building that capacity within public health departments to better serve your community. You also get to interact with community members on issues related to public health and receive training through our Foundations of Public Health course, which has been built by the CDC exclusively for Public Health AmeriCorps members. And then finally, all Public Health AmeriCorps members receive a living allowance and an education award at the end of their service. And we provide opportunities for career development and for networking. So just as you can see here, we're connecting members to public health leaders through things like a public health leader speaker series, through involvement with national public health organizations like ASTO and ASPPH, who are sponsoring the webinar today. And we're providing additional optional trainings around various issues in public health. Finally, we are providing additional resources through our partnerships with hundreds of employers and schools, giving AmeriCorps alumni access to tuition support and connections to the career pipeline. So before I jump to my last slide, I wanted to highlight just one quote from one of our Minnesota Public Health Corps site supervisors. The PHA member came in with no public health experience at all. She has grown and learned, pushed herself out of her comfort zone, and found a passion for mental health education and advocacy. And perhaps most importantly, her site is considering hiring her on for a permanent position in mental health work. So that's exactly what we're looking to see. And if you're interested in finding out more after today's webinar and after hearing from some of our partners and members, I'd encourage you to visit americorps.gov/publichealth. You can also email us at publichealth@americorps.gov if you're looking to talk to our team, or if you have questions about recruitment or the application process, you can email join@americorps.gov. So Public Health AmeriCorps members are already working across the country, helping us to fulfill a promise to improve the health of every community. And we do believe that this program will open the door of public health to a new generation, bringing new talent and new ideas to this really critical sector. This is where you all come in. We're looking for individuals who have a desire and an ability to work in their community to address these public health challenges. And we're looking for folks who are eager and willing to learn and serve others. So I'm really excited about the conversation today. Like I said, you'll hear from some of our Public Health AmeriCorps members in just a minute, but excited for the conversation. And I think with that, I will turn it back to Tracy.
Thank you so much, AJ. I love this program, so I love hearing about it and hoping to get everybody excited about joining Public Health AmeriCorps. So at this point, I'd love to invite all of our panelists to their cameras. I think we have everybody now. All right, so we will start with a moderated Q&A, and then we'll turn it over to the questions that you all are submitting. All right, so let's get started. To start, I want to hear about your path to public health. When and how did you decide to enter this field?
Hey everyone, Jennifer Curator Tyson over here at Appalachian State University. I was actually an undergrad at Appalachian State University and a senior when I scored my AmeriCorps position nearly 20 years ago. And from there, of course, as many others, it changed my path. I worked in occupational health and safety for a long time, mostly working with theater and opera companies. Then I started to work with some doulas and midwives in the community and gained a lot of experience, was doing public health the entire time, just didn't quite realize it, as a lot of us find ourselves. Got a job working in social services and decided that I needed to go back and further my education, and ended up getting a master's in public health with a focus on maternal and child health. I've been working in practice-based public health for the greater part of about 10 years. I even worked during the pandemic as a director of public health preparedness to stand up some new pillars within our local programs. Recently, I've pivoted to full-time faculty in the public health program at Appalachian, and a lot of students, when I first started, they would reach out and say, I want to be a part of this. I want to get plugged in and connected. How can I do so? So we saw the grant opportunity between the CDC and AmeriCorps, and it was a great fit. And now here we are. We'll talk more about what we do in a little while.
Hi, I'm
Great,
Karen Perez. Hi, I'm Karen Perez, and I work full-time as a Public Health AmeriCorps member here at App State. I actually recently graduated here with an exercise science degree. And I knew that I wanted to, like Jennifer, pursue maternal health through med school, but I wanted to really connect with my community and gain more experience primarily. And so Jennifer encouraged me to apply here, and so I did, and it's been great. I've loved it so far.
Thank you. Sade, do you want to share your experience?
Sure. I didn't know which order we were going in, but hi everybody. My name is Sade Ali. I am one of the program managers for Public Health AmeriCorps for the program Community Health Pathways. It was originally Baltimore Community Health Corps, but we switched the name because of our connectedness with the pathway idea, and we'll talk more about that later. Can everybody see me, like see my video and everything? Because I'm paused in my view.
We can see you. You're great.
Look good to us.
Okay, awesome. So yeah, I didn't think I was doing public health. I started off at a FQHC program with the Suboxone program in dealing in addiction medicine, primary care, and pediatrics. Then I moved to different specialties like exercise medicine, urogynecology, and urgent care and occupational medicine. Urgent care and occupational medicine got me thinking about public health, but I wasn't really sure what I was doing, especially when the COVID-19 pandemic started. So I was working in an urgent care center and doing occupational health. So that was a different type of population. Once the pandemic hit, I switched gears to becoming a youth advocate with children and adolescents with emotional challenges and mental health challenges, including people on the autism spectrum and everything. Then I switched and went back to healthcare as dual medical assistant and case manager because of the special population that we served in Baltimore City dealing with addiction medicine. Again, because I actually worked with an addiction medicine specialist that had he had he was dually certified in primary care and addiction medicine. And then now I am a program manager for a public health initiative in Baltimore. So that's how I ended up doing public health. And my background is actually in psychology. I have a bachelor's of science in psychology with a minor in biology. And I took a class called epidemiology and communicable diseases, which helped kind of solidify my love for public health because of the contact tracing and some different different like strategies on how to deal with public health, especially dealing with the COVID-19 pandemic. So I think that's it for me.
I love it. Thank you. And I don't think CL has been able to join yet because with her technical difficulties, so we're going to move on. That's good.
Okay, that's fine.
Okay, great. Hopefully she can make it. So I have to say, I love hearing everybody's pathways into public health. It's one of my favorite questions to ask public health people because it's such a broad field and there's so many different ways that people get interested. But let's shift gears and talk about your current experience. So can you all share a little bit about the specific program you're working on, Public Health AmeriCorps, and how it impacts the communities that you live in?
Yeah, Sade, is it okay if we start? Yeah.
Of course, go ahead.
So like I mentioned, pivoting from working in direct practice in 2020 to being a full-time faculty, a lot of students reached out to get plugged into the community, become volunteers, and at the same time learn about public health and become leaders as they graduate. So we started a fellowship before we got this grant funding to make it fully official and bringing AmeriCorps members on. one thing that we noticed was, the disconnect, public health is saying, we need people, but then students are saying, I can't find a job. So those two things counteracting each other, this project came to be. We did a lot of research on figuring out what evidence-based interventions would be helpful in rural Appalachia. We connected with our Division of Public Health people with specialties in public health preparedness and response. We analyzed some social determinants of health data and realized that psychological first aid would be an excellent first approach. So that's what we're doing in the 25 counties, and Karen will talk a little bit more in detail. The other element of our project is focusing on a medical reserve corps. So not only are people not getting jobs in public health, but public health also needs volunteers, but they're having a hard time getting volunteers at the table. Meanwhile, we would send out Google Sheets to try and recruit volunteers, and we would get hundreds of people signing up right away. So clearly there was a disconnect between the volunteering. So those are the two main parts of our project as a whole. You want to take it from there?
Yeah, so what we're working on is a initial response for disaster interventions that is designed to address surge capacity. This curriculum was made for individuals that have been affected by a disaster or a trauma event. And this curriculum also provides like the safety and stabilizing of those individuals who have just survived whatever like event that happened, addressing it primarily, and what separates our psychological first aid from other psychological first aids. So ours is called Rapid PFA, is that our curriculum is evidence-based, and it was created by Johns Hopkins University, and it's free, completely free, which has been another like problem that other PFAs exist, just not all of them are free essentially, and it's 6 hours. And it's also designed for individuals who have no formal education of mental health. So it like has an accessibility to everyone in Western North Carolina, which is, we have 25 counties that I as an implementation team lead are trying to make it accessible to all of our counties. And I also we created a transcript that is completely in Spanish for non-English speakers to have that accessibility. So that's what we do.
Amazing, thank you.
I can definitely go ahead and jump in. That is amazing. Definitely creating one in Spanish. If you could forward that to me, that would be great. We have a large Spanish-speaking population up here in Maryland. So I am one of the program managers for Public Health AmeriCorps, Baltimore Corps. We call ourselves the Community Health Pathways. Luckily, our program is so popular and it keeps growing every single day. So we're going to be standing apart sooner rather than later. But this program is amazing because it does give back to the community. It basically gives our community members respect, passion, and also a place of purpose to think about giving back to the community and what does that mean. And also just a sense of pride. We do a lot of, with our members and the people that we train and are in our program, we do a lot of one-to-ones where we give that individualized coaching. You get career readiness coaching, you get that educational coaching and everything. And what I've really heard was people having a community now of other like-minded individuals that are interested in giving back to the community and interested in bettering their community and interested in addressing the social determinants of health, and also giving education, health education and wellness resources. Also, we do the psychological first aid as well. We call it mental health first aid. We also do Narcan overdose prevention training as well, because of our unique population in Baltimore City being plagued by the substance use. And just having that as like a resource, because we are also providing training to community members on how to give Narcan and how to spot the signs of an overdose and how to act fast. And that is something I believe that everybody in the community should know. And they also should know when someone is having not such a good day mentally. We should also know the signs of that. We should have, first aid. So we have pathways. Like I was saying, we have certified nursing assistant, community health worker. We have violence prevention navigator, which is a popular one now. And then we have a community resource connector. I'll talk about violence prevention navigation because one of my members, CL, was supposed to be on this call, and unfortunately, due to some tech issues, it's very windy in Maryland, they were not able to make it. But what their job is essentially, and they are non-binary, so that's why I'm using they, them, is working in the mayor's office and also going to different communities after a traumatic event or a crisis and really apply those intervention strategies, talk to the teachers, talk to the students if the crisis occurred in school, and provide any resources, any information on how to deal with the crisis, and if anybody needs counseling. That is a very important thing. And also talking and counseling with kids that aren't not used to this crisis intervention kind of strategy, and also understanding and providing confidence to kids that they are safe in schools and they should be safe in schools, and that's not a far-fetched idea. So that is just a few ways of how we are going into the communities, and we're changing the narrative. We're changing the narrative of people in Baltimore, in the city of Baltimore. Not only are we exporters of not so good things, we are also exporters of artists, dancers, rappers, singers, performers, and also people that have amazing resilience that are doing this kind of work in their community every single day. And one day out of the year, we're giving them their flowers. So thank you.
That is so cool and such important work. I love it. This is so fantastic. Let's switch gears. I'm going to go to Karen specifically. Can you talk a little bit about what's been the biggest learning experience or the proudest moment so far? And also, how long have you been in your role with Public Health AmeriCorps so far?
Yeah, I have been in this role since August, I believe. So pretty new to it. I believe my proudest moment or my biggest learning experience has really been connecting with my community. There's a lot going on in rural Appalachia that not everyone really knows about, like in Mitchell and Yancey County, which is a county maybe an hour away from us. Their birthing center closed down, and a lot of women are having to drive an hour away to even have that like quality of care for their children or to even give birth. And like a lot of women have been reporting like needing more breastfeeding education and more support and general postpartum education. And a lot of these women are also Latinx women, which I am a Latinx woman. But another proud moment is we recently learned about Immigration Mountaineers movement, which is a movement where immigrants can come together and like confine in each or have support from each other here at App State, and just really like connecting with those community members, and also spreading psychological first aid has been a really life changer experience, and I have really enjoyed it. And I've really enjoyed really connecting with them in a deeper level, something that I would have never had a chance to do had it not been for this program. So it's really amazing.
Sounds like it. That's so cool. I'm going to stick with you for a moment and see what you're thinking at this point in time about what you might do after your Public Health AmeriCorps year ends.
Yes.
But then after Karen responds, we can open it up to the site supervisors as well.
Yeah, after AmeriCorps, I plan to get my MD and PH, so go to medical school and get my master's in public health as well. I hope to become an OBGYN eventually and go back into maternal health and be able to help those women and eventually even reach women in my country, where I'm from, like sex ed, basic sex ed or female care is not a thing. It doesn't exist. Not a lot of women know about it. Not a lot of women know how to take care of their bodies or how to handle postpartum, or how it's not even acknowledged that women don't even have postpartum depression or like problems like that are occurring in Latinx countries and Hispanic countries that not a lot of people are aware about. So that's what I want to do. That's what I plan to do.
That's great. And I think that this experience will be a great one on your resume and application for MD and PhD programs.
Yes.
So Jen and Sade, do you want to talk about if you want to share what your long-term goals are for your careers, where you see yourselves going?
Sure. Yeah, sure. First question though for Karen, where are you from?
I was born and raised in Durham, North Carolina, but I'm from Mexico.
Mexico. Okay, awesome. I was just asking, definitely want to talk to you about how you plan to provide information for Latinx communities, especially about breastfeeding and those different child development skills. I'm very interested in that.
Oh, yeah, of course. There's a lot of research in it too. So.
Oh, awesome. Let me know. I'll drop my email in the chat. But for my aspirations is to be a part of a master's program for applied molecular biochemistry and biology, because I want to study DNA and the effects of DNA on public health and stuff for different communities, for particular communities, how social determinants of health actually affects DNA. Also, after that, I would like to pursue a PhD so that way I can become a health psychologist, so I can work with primary care physicians on delivering mental health. As a part of the primary care model, we should be getting checkups on our physical health once a year and our mental health. And so that way we can be more and take up more of a preventative stance instead of a reactionary stance on our mental health. And then also, I plan to continue teaching, continue coaching. I'm also a counseling student right now. I do behavioral health counseling along with substance use counseling as a student. And so that's my next steps, honestly.
I love that. And I know somebody you should talk to. We should connect after this.
Yeah.
Okay, awesome sauce.
I think I've told you most of my career. I'm happy to answer any specific questions in the Q&A time, but I did want to highlight a couple of our other members. One of them just got his dream acceptance, Damon. This is a shout out to you, to Real Madrid, where he's going to be moving to Spain and finishing doing his sports nutrition and medicine. He's going to correct me because I'm a little bit wrong on that, but he eventually gets to work with the Real Madrid sports team doing these things. So that is excellent. I'm also really excited to say that about 90% of our AmeriCorps who are full-time plan to re-sign with us for a second year. So I wanted to put that out there because 1 year is a short amount of time. What can you get done? How can you complete it? But there is an option with AmeriCorps to complete multiple years.
And we want to see it finish through. We want to see psychological first aid in all 25 counties. We want to see it excel, even nationwide.
Yes.
That's fantastic. Thank you. All right, last question I have for you all before we switch to the questions from the audience. But what advice would you give to somebody who's considering applying for Public Health AmeriCorps?
Oh, well, so I'm a program director, right? So I'm like the person that hires and fires, right? My biggest piece of advice is put yourself out there. be sure to connect with people. Sometimes putting out a cold application is great, but it's even better for you to reach out to people, get to know them. Shana is agreeing with me. You've got to create those connections. And then the last piece of advice I would give once you get that job is to self-advocate. Be sure that you are advocating for what you want, what you can bring to the table. Karen has done an amazing job of this. And because of that, we've been able to really tailor her experience around what she's interested in.
Yeah, I agree.
And I shouldn't have said fired. We don't fire anybody. No one's been fired, for just to be totally clear.
Yeah, definitely put yourself out there and communicate with whoever is directing it. Yeah. And you won't regret it, I promise.
I mean, that was great. I mean, definitely advocate, network. We also teach you how to network. So it's just good to have those skills coming in the door. And then we'll teach you the rest of this stuff all the way. I want to actually emphasize you don't have to have prior experience in public health, and you'll learn everything you need that and more being in this program. Everything is a learning experience. I'm a program manager. This is the first time I've been a program manager of anything, but it is a constant learning. It's a constant, okay, let's scrap this. Let's try it again, because what me and my team are doing, we're very intentional with what we do. We think hard about how it could be perceived. We also do a lot of rundown calls and a lot of, like, let's go back to the drawing board. That's not what we were aiming for. Let's do this, let's do that. And I guess the way we are reflects in our members, because our members don't ask for less. They ask for more, and they always advocate for themselves, and we always advocate for them. So
Well said.
This is excellent advice. Yes, thank you. All right, at this point, I'll invite AJ back on. I'm gonna share my screen for one more second, just as a reminder. I think everybody seems to know how to use the Q&A function, because I see questions are streaming in. All right, so let's get started. The first one probably goes to AJ. Do members need to be full-time, or are there part-time opportunities?
Thanks, Tracy. I'll answer that one, and I will also there are a handful of others here that I can just answer all at once. So we have both part-time and full-time positions. Different programs across the country are approaching their service opportunities differently. So there are opportunities for both. I would just put another plug in for AmeriCorps.gov/public health. If you go to that website, you can jump to the state where you are located or where you're interested in serving, and you can find potential opportunities to serve. Of course, we have Baltimore Core, where Sade is from, as well as App State. So those are the two opportunities that we're highlighting here. But I did also just want to highlight a couple of other things. First of all, the stipend or the living allowance is paid out over the course of your service term, but it is the education award that you receive at the completion of your service. So I think there were some questions about that as well. I share the question about whoever asked about whether the folks on the line with us today sleep because of everything they're doing. Maybe you all can answer how you manage, how you do work-life balance. So let me, I just wanted to hit some of those high-level pieces. Tracy, I'll turn it back to you.
Thanks, AJ. Well, let's ask that. How do you maintain work-life balance while you're doing all this important work?
Time management. Jennifer's very flexible, we're very flexible, yeah. And if one day it's very overwhelming and I need like a day off or a little break, she's more than willing to say, yeah, prioritize yourself, really, or advocate for yourself as well. But mainly time management.
I would definitely say, yep, time management. Also, just listening to your body. Sometimes your body gives you, signals that's saying, come on, you're pushing it. So when you have that, just make sure you have buffers in your schedule. We also do a lot of self-care techniques, and especially we give members information on how to perform self-care. Just being in the medical field and just being that direct support person and on the ground running, I understand how it can be very hard to not get burnt out, especially with all of the aftermath of the pandemic that we went through. So just knowing that, just giving my members the tools, also giving them the support to advocate for themselves. If it's too much, it's too much. Let's try to find a way to still get this done, but find a way to kind of modify it. So definitely communication. Also, just knowing your limits and communicate those limits in a positive way. And I guarantee you, whoever is with you or whoever is supervising you is going to understand, because they've been in your shoes. I've been in your shoes. I can't tell you something to do that I haven't done. Like, I can't tell you that. So
I love it. It was the benefit of the public health world, right? Is people kind of get it and are supportive of each other, which is fantastic.
Tracy, thanks for saying that. And Sade, I just want to echo what you said. Boundaries, limitations, knowing where those exist, it's really healthy. But I'll also say that as someone who works with 22 different members at Appalachian State University, everybody is so different, and what works for one person doesn't always work for another person, and how to come up with those strategies. Ask that of us. One of the biggest things, I'm hoping AJ agrees, is that this project, this position, this service should also benefit you as much as you are benefiting the community. So that's a two-way street. You can't show up every day and do this work. And Tracy's shaking her head because it is public health. We're really good at this. We're really good at asking questions like, okay, here's what I need. I need to talk to someone about it, and I need to figure out a new plan. It's never wrong to reach out to people and ask for help.
So important. Thank you, Jennifer. Okay, so what's something that you didn't know when you started that surprised you about your AmeriCorps experience? This could be Karen or the site supervisors.
Oh, you can go. Well, I can talk all day. I was surprised at the level of leadership that these members bring. And I say that because most of them are either seniors in undergrad or they're freshly graduated out of undergrad, trying to figure out what their next steps are. And I know when I was that age, I did not have my stuff together, and I had a long learning curve. So I'm just really excited that not only are we focusing on public health in our communities, but also these people are bringing amazing leadership skills. They're willing to put themselves out there and be vulnerable and get to know their communities, be present.
I was surprised about the need. We did like a ratio of patient to, or like, what was it, like a ratio to provider, and the need for even mental health is very drastic. Like, I know some counties have 1,000 patients to one provider or 400 to one provider, and the need is what really blew me away, and the statistics and the research of it. Yeah.
Yeah, I would say that too. Well, it really didn't surprise me, honestly. I was working in the field and I knew people were burnt out. First responders, they really got it. Like, we were heroes, but it wasn't so good for our mental health, and just going into work not knowing what was going to happen every single day. So I recognize that, and I see that. What surprised me, honestly, was with my teammates, how very intentional they are with what they teach our members, and the types of trainings we hold. And we're holding like a retreat, mid-year retreats this Wednesday where we are highlighting women in leadership, and very intentional. We basically teach skills that are lifelong, and we don't sugarcoat that, and we don't underestimate that. And that's what really surprised me. And honestly, that's what I've been looking for in a team, in a job, just knowing my purpose and knowing what I'm supposed to do, and also having a position that lines up with that. So I'm very surprised at that. Also, I'm very surprised at the amount of adversity our members go through in order to go to their placement sites, in order to go and do their CHW or CNA practicums or curriculums. I mean, the amount of adversity, stuff that I haven't even dealt with as an adult, they have dealt with it as an adolescent or as a young adult. And just amazing. These stories, just listening to everybody's stories is amazing. And it's just like, it tells you every day why you're doing this. So it gives you purpose every single day.
Gave me chills. Thank you. That was great. AJ, I've got a couple of questions for you, some specifics. So one, are international applicants eligible to apply?
So the only eligibility requirements for AmeriCorps that you have to be 17 years old, and you have to be a U.S. citizen, a U.S. national, or a lawful permanent resident. So those are the requirements at this time.
No problem. I'm going to stick with you for a couple more. How do you find out if there's Public Health AmeriCorps in your city or state?
That's a great question. I'm going to refer you all back to AmeriCorps.gov/public health. On that site, you can sort by state, and you can identify all of the organizations that are funded through Public Health AmeriCorps based on state. Someone was asking about Alaska in particular, and I just dropped in a link with the Alaska opportunities. I'm not getting to all the questions as quickly as possible, as I can, but that's the place to start. And again, I'll just refer you all, if you are interested in learning more about recruitment, or if you have specific questions around recruitment, you can email join@AmeriCorps.gov. If you're looking to get in touch with the Public Health AmeriCorps team, we're at publichealth@AmeriCorps.gov. And we're excited about the amount of interest here. This is great.
Yeah. So one more for you probably. We heard about a couple of different areas today, but are there other topics that you can get involved with Public Health AmeriCorps? Like public health topics?
Yeah, there are also, so I will say there are a broad range of public health topics. I think one that we haven't touched on today is nutrition education and nutrition activity, which is incredibly important. We have a number of programs that are working either on connecting individuals to nutrition education, or working on sort of farm to table opportunities as well. So I wanted to point out nutrition as one area that that falls under Public Health AmeriCorps. The second thing I just wanted to call out also is we have a number of organizations that are working on supporting survivors of intimate partner violence or sexual assault, and sort of helping public health departments build their own capacity to respond to survivors and their needs. So those are two areas. But I think if there's one thing I'll stress in this conversation, it is really the breadth of public health and what it means to be a part of public health. Opportunities to serve, careers in public health are really, really broad, and there's something for everyone. I'll just go back to Donovan, who I talked about at the beginning, who's working on HIV prevention campaigns, communications. Public health professionals, are health communications specialists. There are just such a wide range. We have food and safety inspectors, really just such a wide range of opportunities. And Public Health AmeriCorps is one way to figure out how or which opportunities might be right for you. So thanks, Tracy.
Sure. Okay, I think Karen or Jennifer had mentioned Johns Hopkins training, and somebody was wondering if there's a link to that, if it's publicly available. If there is, could you share it in the chat?
Go ahead. Go ahead.
Oh, well, yes, it is. We can share it.
It's through Coursera, free of charge.
Oh, great.
If you Google rapid psychological first aid, there's a baseline project that Johns Hopkins put out there. Yeah.
Awesome, thank you. How about, what does your day-to-day look like? What is it? Is there a typical day, or what do you expect?
It's not a typical day for me, so I will defer to Karen.
Oh, I feel like our day-to-days look very different every single day. It really depends on, like one day I can be out in like Mitchell or Yancey County or other counties doing community engagement programs, or we're here brainstorming about psychological first aid and even possibly creating a new curriculum for it. I don't know if that was.
Yeah, that's fine.
And that's basically what we've been working on, mainly modernizing it, making it more applicable to people now, just because it's a little bit outdated.
Yeah.
That's what we've been working on.
We also, the team does a lot of communication strategies. We have a whole team dedicated to evaluation, social engagement. Like I mentioned, we're standing up the Medical Reserve Corps, so there's a team that focuses on that. So honestly, that self-advocacy piece is really important, because you said, this is what I want to work on, this is where I want to go with this, and this is the perfect position to make that happen.
Oh, wow. Can I jump in? Because y'all are talking real stuff here. A typical day, I don't have a typical day. My days are different depending on which role I am fulfilling. Because I am a program manager, I wear different hats. So I can do case management one day if it calls for it, if my members need resources that are provided in the community. I do collaborate with social workers and other case managers in order to meet that need. And for them, I'm very grateful. Also, I can be a counselor. I can I can be an encourager. I can be someone that's high energy. I can also facilitate meetings. I helped facilitate a training and also helped present at our information sessions, and we call them edgy sessions because you always learn a little bit of something in our sessions. So, I mean, it really just depends. I can be in meetings all day working on higher level overview program stuff, like taking this program to different cities. How would that look? Also, just taking a survey of our community and also figuring out if we need to provide extra services based on the survey of the community. I could also deal with, again, day-to-day stuff. So making sure timesheets are done, providing coaching, that one-on-one interaction with my members and also with my site supervisors. So that way, making sure that the goals are being met, both on a program level, from a member level, and also from an AmeriCorps level. So it really depends. I'm playing hot potato, but I really think like if creative people, if you're very creative, you can do a job like this. If you like your days looking different every single day, then this is what it's for. Like, sometimes my head is turning around because I have so many things to think about, but it's amazing. It's definitely worth it. I know my purpose every single day. My team is very supportive and very encouraging, non-judgmental. So that's all I can ask for.
That's amazing. Lots of hats, but keeps it interesting for sure, it sounds like. Okay, I think this might be back towards AJ, but are members required to travel, or are there opportunities to travel and different member opportunities? And also, are there remote working opportunities?
Great question. So just with regard to travel, I don't think that there are very many positions that require travel. It's not a requirement to join the program. I will say in some cases you may be seeking out opportunities that are not where you live now. So if that's the case, then you might need to travel to where the opportunity is. So that's answer to that piece. In terms of remote opportunities, that varies by program. Most of our programs are providing and doing in-person service. So I think the fully, we are leaning towards folks really having those professional development opportunities where you're working in person. As you can see, Karen and Jen are sitting in the same room. So we lean towards that to help build those relationships and make sure that you're getting all the access to the training and hands-on experience that you need.
Great. I think this might be one of our last questions, or maybe two, but we talked a lot about you only have to be 17 to apply, but are positions really geared towards that 17 to 24, or can you be eligible if you're maybe more experienced under your belt?
Yeah, absolutely. So a couple of things. We have been talking about that earlier in career set today, but that being said, we welcome individuals of all ages to join us. And you may be looking for a second career. Great. We would love to have you learn more about public health opportunities. You may have volunteered in your community as a contact tracer at the very beginning of the pandemic, and you may be looking for ways to turn that into a career. Great, jump on board. You may be retired and looking for ways to engage. Public Health AmeriCorps is definitely an opportunity to do so if you're looking to try out a new career. So we have been talking about the younger ages, but we welcome and encourage anyone who is interested in joining us to do so. I believe we have at least a couple of Public Health AmeriCorps members that are in their 80s. So we also have many who are 17. So we're a range, and we welcome all who want to participate, and we encourage the diversity among our teams. So thanks so much, Tracy, for that question.
Sure, I love that. Okay, so to make sure we wrap up on time, I just want to, first of all, thank you all for such an interesting and fun conversation today. So I really appreciate it. The webinar has been recorded and will be made available on our website soon. This is the link. If you have any questions, you can contact us. Also, as AJ said, it's National Public Health Week. This is just the first of our webinars for this week. So you can sign up for any of the rest of our webinars that are happening this week. We would love to have you back. And finally, thank you again. Thank you, the panelists and AJ, and for all of you for attending. Have a great rest of your National Public Health Week, and I can't wait to see you all get involved with Public Health AmeriCorps. Have a great day.